If you're someone dealing with knock knees and your knees look something like this, then this video is going to be helpful for you. Today, I'm going to discuss 5 effective exercises that you can use to help correct knock knees for good. Let's get started. Now, if this is your first time here, my name is Dr. Mike, and I'm a physical therapist providing tips on how to build strength and longevity with your body. Now, most of my patients that have knock knees are also dealing with some sort of knee pain, knee instability, ankle pain, and even difficulty walking. Now, let me explain what's going on here. Now, in a perfect world, we'd like our knees directly stacked over our feet and directly under our hips. Now, mind you, we're all built a little differently. Some of us have wider hips, some of us have more narrow hips. And so in a perfect world with our feet apart, we want our knees kind of stacked in a good alignment over our joints. Now, knock knees or having caved in knees is essentially when these femurs and the tibias, which are the lower bones of our legs, essentially go into internal rotation. So those knees kind of go in this collapsed position. You have the femurs going in as well as the tibias going in. And we lose control of 2 things. And these are our problems and our drivers that we're going to focus on today. But number 1 is the arches or the support and stability of your feet. So if you have hyperpronated feet, your feet tend to kind of collapse in, which leaves this knee in a very vulnerable position. So as you build strength through your foot muscles, they tend to be more stable, as well as the other second problem is weakness of the hip. Okay, so if we're weak in our glute muscles, specifically the glute abductors, glute medius, this controls our ability to have those femurs externally rotated, to have our pelvis nice and leveled, to prevent any kind of downward force or movement in the pelvis. So as we build strength through those hips, we're going to start to see those knees start to straighten out. Now, some of us more severe than others. Now, just know the problem is in the foot and in the hips, and the exercises that we're going to discuss today are going to address those same issues. Now, keep in mind, if our knees are caught in this position, we are going to develop a lot of stiffness and tightness on the inside of the hip, which are our adductors. Those are the muscles on the inside, which will make it difficult for us to really get in that position. So one of the first things we're going to do is help focus on your flexibility, and then we're going to move on to some strength. Let's get started. Now, the first piece in correcting these knock knees is addressing the stiffness and tightness that you're going to have on the hip adductors, which are the muscles on the inside of the thigh. The way we can address this tissue is by sitting in a butterfly stretch. Now, you've probably seen this stretch before where people are kind of just slouched over and their back is rounding. They're just grabbing their toes. And sure, you may feel that stretch, but I actually like to use this performed against the wall because this will prevent you from slouching your lower back and will allow you to have a reference from getting those shoulder blades back and trying to sit up nice and tall so you get a good stretch through the femur there. Now, you can sit here and just provide a little bit of overpressure with your hands and you'll feel the pull on the inside of those hip muscles and you'll feel a nice good stretch on the inside. Now, sometimes just overpressure of your own hands, it's kind of hard to get a good leverage with your hands, so you can use an additional weight like a dumbbell or a kettlebell and kind of gently place it over the knee there, and the weight is going to drop that knee down even further with some overpressure. You're just trying to sit up nice and tall, feeling a nice good stretch, and you're going to hang out here for at least 30 to 60 seconds, and you could be doing this on both sides to really help open up those legs and reduce the stiffness that you're having on those inner thigh muscles. So now that we've addressed the tightness and the stiffness on the inside of the hip, now we're going to focus on an exercise that's going to help build stability through the arches. Now you're going to just use a rolled up towel here and you're going to place it in between your ankles, okay, just like so. Now, what I'm trying to do with my ankles is I'm trying to squeeze the towel as much as I can as I raise up on my toes. What this is going to do is it's going to help facilitate a lot of the calf muscles as well as the muscles that support the arches there. Okay, so as I'm raising up on my toes, I'm still trying to push the towel or squeeze the towel together and raise back down. You'll notice if you don't have a towel, the tendency is you're going to want to kind of roll on your toes and your ankles are gonna separate. And so that's why using a towel is really gonna allow you to keep those legs nice and straight and really focus on building strength through the arches there. You can work on 3 sets of about 12 to 15 repetitions at a time. Now we're gonna move on to some exercises that are gonna help strengthen and build stability through the hips. Right here I have a small band wrapped around the top of my knees here. This is called a standing hip clam. And notice that our knees are gonna be starting in this position here, and I'm gonna use my hip abductors here, and I'm gonna pull those knees outward, really trying to create that external rotation of the femur, okay? Once again, I'm pulling outward with my knees into the band. I can even place my hands along my hip muscles, and I can feel the muscles that are working to control that movement of the femur here. You can work on this exercise for about 3 sets of anywhere between 15 to 20 repetitions. Moving on to the next exercise, which is gonna help facilitate our glute abductors as well as facilitate the core muscles. You're gonna start on your side with your knees and your feet stacked. Notice I have the band above my knees here for some extra resistance. You can also do this without the band, so don't worry. And I'm gonna be propped up on my elbow just like so, okay? Now pushing my elbow into the ground, I'm gonna lift my hips up, trying my best to stay in a nice straight line. And as I'm ready, as I extend my hips forward, I'm gonna separate my knees while keeping my feet close together. Now, one of the common errors that we'll see people do is because of the band and the resistance is too difficult, they tend to kind of turn their hips and turn their body, when in reality, you wanna try your best to stay nice and stacked and aligned as you are in a nice straight line. You'll feel your abdominal muscles kicking on, you'll feel your core, as well as that bottom leg really working hard to keep you upright. Then you'll lower back down. So when you're working on these holds, you can hold that at the very top for about 3 sets, 20 to 30 seconds at a time, and you'll really feel all of those muscles working very hard. Now the last exercise we're gonna go over here is the banded squat. Now I have the band just as in the previous exercise, just above my knees here, and this is going to give me that tactile feedback and that cueing to help pull my knees outward. Now I'm gonna set up in a squat stance with my feet about shoulder or hip width apart. I'm gonna slowly start to drop my hips straight down as I'm pushing outward into the band. If squatting below parallel is just too difficult, maybe because of knee pain or hip pain, just go as far as you can go with this, okay? So you're gonna push outward into the band, continue to resist the band and that force from pulling you inward as you squat. You're really gonna feel all your glute muscles firing, and you're gonna stand back up. And as you perform this, you can perform about 3 sets of 10 to 12 repetitions at a time. Now, what's important to note is as you develop some consistency with this program, you definitely don't wanna neglect the lower leg, which is the calves, and the strength in your glutes. If you want more information on how to do this correctly, check out the 2 videos I made here. In the meantime, if you enjoyed this video, please like, subscribe to the channel, and if there are any topics you want me to cover, please list them in the comment box below. I'll see you in the next one.